If you are a clinical officer in Kenya and you're interested in working in the UK as a physician associate, this video will walk you through the exact process step by step. We'll cover the eligibility, exams, English requirements, and registration. So stay until the end. First, let's clarify what a physician associate is. In the UK, a physician associate or a PA is a trained healthcare professional who works alongside the doctors to diagnose and to manage and treat patients. They do order for examinations and manage treatments under supervision, obviously, of the doctors. And they are now regulated by the General Medical Council, also known as the GMC, which means registration is mandatory to practice. Now, here's the big question. Can a clinical officer trained in KMTC register to become a UK PA or physician assistant working in the UK? The answer to that question is yes, and I'm going to tell you exactly how to do that. So, step one is the qualification assessment. As a Kenyan clinical officer, your qualification is considered an overseas healthcare qualification. Before anything else, the GMC must assess whether your training and clinical experience are comparable to that of a UK trained physician associate. So you will submit details of your qualification, including your certificates, transcripts, curriculum, and clinical training. Then the GMC looks at the length of your training, the subjects covered, and the level of supervised clinical practice. There is a qualification assessment fee, and this step can take several weeks or months depending on the volume of applications. If your qualification is accepted, you can proceed to the next stage. If it's not, you won't be able to continue through the process. And then the step two, obviously, is the English language requirement. So UK is an English speaking country, so you must be able to speak effectively in English. Yeah, so you must be able to tell the GMC that you have good English, and this can be in two ways. So one, you pass the IELTS test or the OET, and the other way is to prove to GMC that your course was taught in English, and we both know that that is the language of instruction in Kenya. So your school will have to write to the GMC to say that that was done in English. And then step three is the Physician Associate Registration Assessment, also known as PARA. So this is a national exam that every physician associate must pass, whether trained in the UK or internationally. And it is run by the Royal College of Physicians. It has two components. The first is a written knowledge exam with multiple choice questions covering, medicine, surgery, pediatrics, mental health, and emergency care. And then the second part is the clinical exam. This is the OSCE, where you rotate through stations. There are actually 14 stations, and you will demonstrate clinical skills such as history taking, physical exam, communication, and clinical reasoning. And you must pass both components to be eligible for registration. So many candidates spend several months preparing for this exam, and is strongly advised to use official preparation materials and practice resources. For a Kenyan clinical officer, I know how intense your course is, and you will definitely pass these exams. So at this stage, once you've passed the para exam, you will move now to step 4, the GMC registration. And at this stage, you will apply directly to the GMC to be added to the Physician Associate Register. You will submit proof of your para pass, your qualification assessment outcome, your English language evidence, identity documents, and declaration about your fitness to practice. You will also pay the registration fee. So after your application is approved, you receive a GMC registration number. From this point, you are legally allowed to work as a physician associate in the UK. Now, a few important tips. This process takes time, so plan ahead. Keep all your documents organized, including certificates and transcripts, reference letters and exam results, and then start preparing early for your para. That is your KBA and your OSCE. Your KBA, that's the knowledge assessment, the multiple choice exam that we talked about earlier. So to summarize, your clinical officer qualifications must be assessed by the GMC. Second, you must meet English language requirements, and we have actually seen that you are not necessarily required to do the exam if you did your CO training within 2 years of applying. And third, you must pass the physician associate registration assessment. And finally, you apply for GMC registration. So becoming a physician associate in the UK as a clinical officer is an absolutely achievable with the right preparation and patience. Okay, so if you found this video helpful, please make sure that you're liking, you're subscribing, and then on the next video, if you guys are happy, I'll tell you how much money you will make as a physician associate and also how to get those jobs. Thank you.